down your spine, and the story can be even more shocking when these same infections are said to occur in children too. One of such infections is a urinary tract infection. But does the diagnosis of a UTI in a child mean a serious situation that should cause any parent so much worry? We have at the table Dr. Annie Owusu, a pediatrician at the Kolebu Teaching Hospital, and she'll be helping us this morning to understand all there is to know about UTIs in children and also educate us on the best ways to look after our children whenever they are diagnosed with a UTI. Doc, good morning, welcome, Happy New Year.
Good morning, Thelma.
Thank you
Happy
for
New
joining
Year.
us.
Glad to be here.
I was reading up a bit on UTIs, and it's very common in women, and it's easy to diagnose when a woman gets a UTI. But for children, it might be a completely different story. Tell us what a UTI infection in a child would be like.
Okay. So I would also just be saying UTI because I also don't like saying urinary. Yeah. So UTIs, yeah. So as the name suggests, it's an infection that involves the urinary tract. And the urinary tract has various components. So right from where the urine comes from to the production side, which is the kidney, any infection along that pathway would be called a urinary tract infection. So it could be the bladder, it could be the tubes linking the bladder to the kidney, or it could be in the kidney. And that will be what we'll call a UTI. So if we've not specified it, then that's the name. But then if we pick specific site, then they have specific subsets or names. So if it's in the bladder, it could be called a cystitis, but it's also under urinary tract. If it's in the kidneys, pyelonephritis, it's still a urinary tract infection.
So which one is the urinalysis?
The urinalysis is just a test that is done on the urine to diagnose urinary tract infection.
Okay, so what causes it? Let's talk about causes. Are we eating something that is bringing this on? Are children eating something that's creating or causing this infection?
No, it's more of anatomy and then general everyday stuff. It's not something we are eating. So urinary tract infections are mostly caused by bacteria. So if we talk about that, it's a bacteria that has gone where it shouldn't be. There's bacteria on our skin, there's bacteria in the anal region, there's bacteria in the vaginal region. So you see all those places I've mentioned are in close proximity to where the urine comes from, especially in females. So if any bacteria gets to the wrong tract, then we have a urinary tract infection. So it's not something we are eating, but some habits that we undertake or some things that happen in childhood could predispose a child to having a urinary tract infection.
Okay, so does that mean that the parents are not cleaning babies well and it's introducing these bacteria into the wrong tract? Is that what is causing?
Yes, cleaning is one of the major causes, and it's not just the babies and the parent cleaning. Actually, the children who are the older children, preschool age, they are learning to clean themselves after using the toilet, especially in girls. When you look at the anatomy, where the anus is and then where the vagina is and where the urine is coming from is in close proximity. So when they don't wipe well, so which is one of the reasons why urinary tract infection is commoner in females than in men, because when they wipe from back to front, they would get bacteria coming to the front side and then tracking up and then causing a urinary tract infection, compared to guys where the phallus is longer and the tube is internal. So you don't get it commonly happening in children and guys. So if you were having 1 in 10 girls, you would have like 1 in 100 boys. So the incidence is lower in boys compared to girls.
So that's why the advice is always to clean from one side to the other.
Yes, from front to back. So children wiping hands are short. They don't. So the tendency is to just go from front and then wipe from the back coming to the front, and then that sort of brings bacteria at that region to the front side. But then when you wipe from the front to the back, then the back goes up and away from where the urine is going to come from. So that does not inoculate that area. So then you don't have the tendency of a bacteria tracking up the wrong way and then causing an infection.
Okay. What's the most telling sign that a child has a UTI?
Okay, so it depends on the age of the child. The presentations are different. So the younger the child is, the more non-specific the presentation. Non-specific means it could be anything causing it. So fever, vomiting, maybe the child is slower than they usually are. So this would happen in maybe infants, that's under 1, or toddlers up to about 2-3 years, who can't really say here and here is paining me or something like that. So fever, vomiting, Some of them will even have diarrhea. They are a bit slow. They are not eating well. This could be signs of a UTI in the younger kids. And this can be malaria. This can be an upper respiratory tract infection. So it's a bit difficult to pick it up in the younger kids. The older ones could say that one of the key things is when they are passing urine, they have pain. So pain on passing urine, they can tell you when I wee-wee is painful, or because of that I don't want to go and wee-wee. Or they go more frequently, so every few hours I want to go and pee, and then when they go, something little comes. Or the scent of the urine. We all know urine has a characteristic scent, but then it may become more foul smelling. So this maybe the mother will notice. And then it may become cloudy. The urine may become cloudy, or there may be blood in the urine.
Okay.
So all these are things that would suggest
painful urination, frequency, foul smelling urine. I didn't know we should smell the children's urine.
You don't have to go smelling it, but if it's not the same as it was, you would notice. I don't know if you get what I mean. Like, we all know urine has a scent, so nobody's paying attention to it. But when it's different, you will notice because this is not what's supposed to smell like. So some others may come to you and even see that my child's urine is not smelling the way it should. Yeah. Not that they went looking, but then it's sort of presented
because it's different.
Because it's different, you just pick it up.
Yeah. Now let's talk about cloudy for a minute. So ordinary urine without an infection is supposed to look like what? So that when it gets cloudy, then we would know that there's an issue.
So ordinary urine is supposed to be clear, and the color would range anything from colorless like water to amber, deep amber, depending on your state of hydration. The better hydrated you are, the lighter it is in color, but it's usually clear. So if you hold it in a tube and you look at it, you can see through it. When it's cloudy, it's a bit turbid, so you're looking and you can't see clearly through it. But for the color, it depends on your state of hydration. But once it becomes a bit cloudy, like maybe somebody has poured some powder or something into it, then you know that there's something going on.
Okay, without going to the hospital, how can a parent know that this child is actually having a UTI infection, as against, because the symptoms are pretty much the same for every other condition that a child suffers. They have some fever, there's vomiting and all that. How can we differentiate a UTI from others so we know when to be concerned?
So it's actually difficult to, but for any child that has fever, vomiting and all of that, you should be concerned. But the next step will be, which one is it? So depending on what other symptoms there are, then you think that maybe this may be just an upper respiratory tract infection. Is the child having a cough? Is the child having a catarrh or all of that? Then you know that, okay, maybe this is likely to be this. But mostly for UTIs in the younger kids, there's nothing else. It's just those non-specific symptoms. So when you come, then we are thinking, okay, is this an infection? Then let's check the blood, let's check the urine. So the hospital will now go along those tracks. But for the older kids, I mean, once your child says when I wee is painful, or you see blood in the urine, then you should be concerned.
Okay. Does it present different in boys than in girls?
As in terms of symptoms, not really. It's about the same.
But does it affect them differently because of the difference in their anatomy?
Again, not particularly, because I mean the urinary tract internally is about the same, so it tracks up if there are complications about the same, because the organs involved are the same. So it's the consequences are about the same.
How bad does it get, Doc?
It could get very bad because, like I said, if a child is vomiting, not eating, leading to dehydration. Dehydration was, in some years ago, used to be one of the biggest killers of kids because they get so dehydrated. By the time you start intervening, it's too late. So it can't get that bad. And then the other side of it is some of the complications that occur, like it affects the kidney now. You know, the kidney is the center that's producing urine, detoxifying the body and removing all sorts of toxins in the urine. So it can affect the kidney and later on can lead to damage to the kidney that we don't want to happen. So those are the extremes. Yeah, sometimes you can even have pus collecting the kidney because the bacteria has been there for so long. And then it affects the kidney, and then we have to do all those imaging investigations and things. And then some people have to have tubes in to sort of even drain.
For a UTI?
Yes.
What's the worst case you've seen?
Complications. So we've seen people with what we call the pyelonephritis, that's a UTI that's now involving the kidneys. And we have kidneys shut down because of that. So acute kidney injury requiring dialysis just because you had an infection that was not managed well or that was missed. So that's how bad it can get. But most of the time, if it's something that is picked up quickly, it will be treated and then there will be no consequences.
Okay, let's bring our viewers into the chat. Our WhatsApp number is active 0555561034. We are talking about urinary tract infections in children and how you can spot the signs and get your children some help. Dr. Annie Owusu is a pediatrician at the Kolebu Teaching Hospital, and she's been answering some of our questions. If you have any, send it to our WhatsApp number. Now, Doc, let's talk about the treatment options. What's the first thing that a parent should do if the baby walks up to you and says, "Mommy, when I pee, it's painful"?
Okay, so the first thing to do would be to go to the hospital, because we can't guess which organism. We can't even guess what exactly is going on. So you come to the hospital. What we do is we look at the urine. So the urinalysis comes in. So we take a sample of the urine. There are two tests that we'll do typically on the urine. So the first one is maybe the urinalysis, just a simple test. They look to see what chemicals are in the urine, and then if there's any bacteria and all of that. Then there's what we call the culture, where we go and then try to grow an organism out of the urine, which is a definitive diagnosis, because that tells us the exact organism, and then tells us which antibiotic it is susceptible to.
Okay, so because you're mentioning urine, there's a whole range of colors I'm seeing on my screen right now, and I know that you will speak to it very shortly. So the ideal urine color you want us all to have, adults or children, is the very first one that looks almost like water.
Yes.
Okay, so walk us through down there, what's happening, what's causing all these changes we are seeing.
So like I was saying earlier, the color basically depends on your state of hydration, which is being shown on the screen. So the lighter it is, or the more close to water it is, the better your state of hydration. As you get more and more less hydrated or dehydrated in the extreme cases, then the color becomes concentrated. So the first one, white, I mean your state of hydration, you just drank water and then you went to pee, like what usually happens at bedtime. Then from there, it's a bit amber, light amber, which is, I mean, you're okay, it's fairly hydrated and all of that. Then it gets deeper and deeper. By the time it's getting to that red one you see, which is actually not, in this case, may not be blood, it's just very concentrated urine, because somebody is severely dehydrated, to the point that sometimes they don't even produce urine because of severe dehydration. So if you're getting that color, it may be because you even pass the tube to see if there's anything in the bladder, into the bladder, to see if there's anything, because the child is severely dehydrated, so they are hardly producing urine. What the body does is, if your water, the amount of water circulating is not enough, it's not going to waste it on urine production. It's going to preserve it for vital organs, so you don't have urine coming out, so it gets dehydrated. The ones in the middle will be maybe if you've gone long hours without peeing, like maybe overnight, you're not somebody who wakes up to pee, so you slept throughout the night. In the morning, your urine will be a bit concentrated because it's been there for longer, and then there's been more absorption of water from it.
Okay, so this is what guides you when you're going to have this urinalysis done, and then
so the concentrations actually tell another story in the chemical workup, the biochemistry of the sample.
Okay.
So the more concentrated it is, you'll pick some things from it that will not be in the lighter ones, like something like ketones. If you come and then you are fine and I do a urinary and I see ketones, I'll go like, okay, maybe you're not drinking enough water.
What are ketones?
So these are byproducts that are produced by the body as a result of maybe your state of hydration, your state of health, and all of that. So if I am having it in the urine and there's nothing else wrong with you, I'll be thinking that, oh, this is because you are not well hydrated. It could also point to other disease states, but if it's a well person and you're just picking only that in the urine, then it's a definition of the state of hydration.
For children, especially for those who have not learned to speak, it can be quite challenging to pick up any distress signs.
Yes.
What should parents look for in non-speaking children?
Okay. So once you have a child who has a temperature, who is vomiting, typically UTIs cause a lot of vomiting. But then again, now Sabridge, malaria also does the same thing. So if you have a child who has a fever, is vomiting, is lethargic. Lethargic means they are very weak. Child who is otherwise playful is all of a sudden just lying there, like you even pinch them and sometimes you don't even mind you. Then you know that something is going on. It could be one of anything, but UTIs are also in the mix there. So when you see that, then it means, I mean, this child is ill. Could it be a UTI? Could it be malaria? Could it be something else? Then you have to sort of start seeking help.
So you're talking about going to the hospital once you see these signs. But for many of us, instinctively, we like to do something at home. What would be your advice?
So it's a bit dicey because you don't want everybody rushing to the hospital at the least thing, because our hospitals will now get overcrowded and then waiting times are longer. But you also don't want people taking certain chances and then we getting into complications because so in children, Oftentimes, there's one thing that we pediatricians will say: we will not treat a child over the phone because we have to see that child, examine the child, because what is it? Is it ABC? So in children, when you see one of these things, first aid for temperature, you would have to give maybe paracetamol for the temperature, because certain age groups can get convulsions if the temperatures are very high. So you can give first aid, but the next thing to do after that first aid, which is you giving paracetamol to settle the temperature, is to get to the facility, because when the child is vomiting, especially when they are vomiting, any medication you give at home, they will throw it up, so it would probably not do much.
Yeah. But then if the child is already throwing up, it makes the dehydration situation even worse.
Exactly.
What does a parent do if the child keeps throwing up even on the way to the hospital? How do you keep the child, hydrated enough to even get to that facility?
You keep offering fluids, but the likelihood is that they will keep vomiting. So when they get to the facility, oftentimes an IV will be passed, an IV line will be passed, so that they can get hydrated, and also so that they can get IV medication. Because a child who is vomiting, you are not going to give the child an oral antibiotic, which is what we use to treat UTI. So you would have to give IV medication to a point where the child is no longer vomiting and can tolerate oral medications. But even in the infants, those ones, whether they are vomiting or not, most of the time they have a UTI, it would have to be IV medication in the younger kids.
I've heard some people say that, oh, if it's an infection, it will clear on its own and you don't need to do anything. It will just go by itself. Is that true?
We say that, but it's not for UTIs. We say it's for upper respiratory tract infections. These are viral infections. So, I mean, if the child is well nourished, immune systems are fine, it should clear, but typically not for UTIs, because if you don't treat it, the bacteria just keeps going up and up and up till it gets to the kidney and then causes havoc. So if it's a UTI, it has to be treated. It's not likely to clear on its own.
Not likely to clear on its own. I have like is there a gene thing going on here when you have, are some people more likely to develop these kinds of infections than others?
Yes. So children, there are certain children who are born with congenital anomalies involving the urinary tract. So those people may be more predisposed to having urinary tract infections. Yeah.
Right. You go on. I want to hear about this.
So the defects could be anywhere. It could be in the bladder or the bladder neck, where there's an obstruction to flow of urine. So the urine sort of accumulates in the bladder. So it serves as a substrate for bacteria to grow, because you're supposed to void. The continual voiding actually washes the tracts of any bacteria that may be trying to make its way there. So you can imagine if you are not voiding as often, or there's an obstruction to voiding, then you are more predisposed to getting infection. There's something we also call vesicoureteric reflux, where the bladder gets full, then the urine sort of refluxes up the ureters, the tubes that are bringing urine into the bladder. So those people are also more predisposed to getting urinary tract infections. In the younger kids, uncircumcised boys could also have a higher predisposition to urinary tract infection, because the hood sort of serves as a place where bacteria can hide and then track up.
Is there ever a situation where a UTI has got to the point where it needs surgery on any part of the system that runs there?
Yes. So if it involves the kidney, that's the pyelonephritis I mentioned, we have pus collecting in there, and it will take surgical intervention sometimes to drain it, along with the antibiotics that you'll be given to treat it. So
antibiotics are the way to go.
Yes, they are the first.
Effectively,
yeah.
What does the antibiotic do? What does it? I'm going to go to the screen and try and get a few messages, but tell us what the antibiotics will do to help this situation.
So like I said, the causes are usually bacterial. So antibiotics are just antibacterial agents, and they sort of kill the bacteria that is causing the UTI. So in the urine CS culture, you make culture on organisms. So they are common organisms. I don't want to bore you with all the big names of the organisms. That the commonest is E. coli, which is actually in the gut region. So sometimes we are able to isolate the organism in the lab. Then when we do that, we can grow it and then test it against antibiotics, and then get which exact antibiotic this organism is susceptible to, then use that for the treatment.
That's a fascinating concept, because chances are, if my child has a UTI earlier in the year and I take them to the hospital and they give me antibiotics A, if they get another UTI in July, I'm going to buy antibiotics A to do. You are saying it doesn't work that way?
It doesn't work that way, because there may be different organisms involved.
Okay.
And then even the same organism may not respond to the same antibiotic at different times.
So
we
don't
try,
assume.
don't just assume.
Great. So there's a comment here on the screen. I'd like to pick your thoughts. It says, good morning, GBC, GTV, breakfast show. My son likes drinking water a lot. As a result, frequently urinates. Is there any problem with him?
So the simple answer is no. I mean, children, I don't know how old this child is. Children at certain age just like to do things, drink water, I want to wee-wee. Sometimes they go and nothing really comes, but they want to wee-wee. But if it's very serious, it may be a sign of something else, because lots of water drinking, lots of urination could also be a sign of type 1 diabetes in younger children. So I can't really tell with only this information. There may be more things, but typically it shouldn't be a problem. Yeah.
Okay.
Yeah.
Is
Maybe.
Is a UTI sometimes a symptom of something that's to come? You know, some diseases present initial conditions and then other things follow. Is it something like that when it comes to UTIs in children?
No, but it may be, it may give you an idea of something else that has been going on that was missed. So if you have a child present with a UTI frequently, 3 times in a year, then we have to, in addition to this urinalysis and things we talked about, we sort of have to image the child, so do an abdominal ultrasound to see if there is a problem with the urinary tract system. Because I mentioned that those who have some anomalies of the system may be predisposed to UTI. So the UTI may herald you now finding what was already going on that we did not know. I don't know if that makes sense.
It does make a lot of sense. And people are just sending us greetings and Happy New Year messages. We are very, very appreciative of that. Thank you for sending those messages across to us. Doc, let's wrap this up very quickly. Is it expensive to treat a UTI in a child? What would you say the average cost is?
Okay, so the average cost will depend on the average cost of the antibiotics and how ill the child is. So for the older kids, when they come, no vomiting, they are stable, we test the urine, we see it's a UTI, we give them oral antibiotics and they go home. The drugs may range anything from 20 cedis to 100 cedis, depending on which one the physician seeing the child prefers or which one the child tolerates. But if it's severe enough to warrant admission, then there's all of the admission costs, and the IVs are more expensive and all of that. So it may be anything from not that significant to quite significant in cost. And these days, with our cost of antibiotics and all of that going up, yeah, that could be a problem, especially if the child has to be on admission.
Okay, and how long are we looking at here for the treatment period?
So anything from 5 days to 10 days, depending again on severity and presentation. If it's
5 to
oral,
10 days.
5 days of antibiotics, 7 days, we are good. If they have to come to hospital and be admitted, they would have IVs for some days and then now complete oral after the vomiting has settled. So 5 to 10 days. But then if it's complicated, that's involving the kidneys, pyelonephritis and all that, we will treat until we get a negative urine test result. So it may drag longer in such cases.
Doc, thank you so much for sitting with us. I've learned so much from this chat, and I'm sure that the viewers also appreciate the information. Dr. Annie Owusu is a pediatrician at the Kolebu Teaching Hospital. She's been helping us understand urinary tract infections in children, and so I'm sure that you have a lot more information to help that child. If they present with any of the symptoms, fever, vomiting, painful urination, frequent urination, foul-smelling urine, or urine that is cloudy, you know that you need to give the child, if they have a fever, some first aid and take that child to the hospital to be properly examined and diagnosed and given the most appropriate medication. Don't self-medicate those children at home. This is Breakfast Live on GTV. You can catch this interview